हेलो गाइस, वेलकम टू माय चैनल। और आज हमारा जो टॉपिक है वो हम देखेंगे ब्लड सप्लाई ऑफ द स्टमक। तो बेसिकली क्या होता है कि जो ब्लड सप्लाई ऑफ द स्टमक होता है वो सीलिएक ट्रंक से होता है। सीलिएक ट्रंक जो होता है उसकी कुछ ब्रांचेस होती है जो कि स्टमक को सप्लाई करती है। सो बेसिकली वी हैव टू सीन अबाउट द सीलिएक ट्रंक। तो सीलिएक ट्रंक जो होता है वो एब्डोमिनल एओर्टा से निकलता है एट द लेवल ऑफ T12। तो दिस इज आवर एब्डोमिनल एओर्टा। And the celiac trunk arises from the abdominal aorta at the level of the T12. This is our celiac trunk. वैसे होता क्या है कि जो celiac trunk होता है इसकी मेनली 3 ब्रांचेस होती है जो इसकी डायरेक्ट ब्रांच है। द फर्स्ट ब्रांच इज लेफ्ट गैस्ट्रिक आर्टरी। दिस इज द फर्स्ट ब्रांच which is also known as the left gastric artery. Then the second direct branch is the splenic artery. And the third branch is common hepatic artery. सो गाइस होता क्या है कि जो हमारा सीलियक ट्रंक होता है उसकी टोटल 3 डायरेक्ट ब्रांचेस होती है। डेट इज गैस्ट्रिक आर्टरी, सेकंड इज स्प्लेनिक आर्टरी, द थर्ड इज कॉमन हेपेटिक आर्टरी। लेटर वी विल नेम ऑल दिस आर्टरीज। फर्स्ट वी हैव टू सी अबाउट देयर कोर्स। सो व्हाट विल हैपन टू द कॉमन हेपेटिक आर्टरी। तो जो कॉमन हेपेटिक आर्टरी है ये 2 पार्ट में डिवाइड हो जाती है। एक होती है प्रॉपर हेपेटिक आर्टरी एंड द सेकंड इज गैस्ट्रोड्यूडेनल आर्टरी। So first part is the proper hepatic artery which ascend upward, and second part is the gastroduodenal artery which is descending downward. The proper hepatic artery then divide into the left and the right branch. होता क्या है कि जो proper hepatic artery होती है वो left और right branch में जाके divide हो जाती है। And the cystic artery that is branch of the right part of the common hepatic artery, sorry, proper hepatic artery. So what we have seen about it, we have seen about that there is common hepatic artery which is being divided into the proper hepatic artery and the gastroduodenal artery, and the proper hepatic artery then divided into the right and the left branch. The cystic artery or the artery to gallbladder, it is a branch from the right part of the proper hepatic artery. Now we have to see a branch that come from the proper hepatic artery, and this branch is known as the right gastric artery. लेफ्ट गैस्ट्रिक आर्टरी जो थी वो ब्रांच थी सीलियक ट्रंक की, लेकिन जो राइट गैस्ट्रिक आर्टरी होती है वो ब्रांच होती है प्रॉपर हेपेटिक आर्टरी की। तो लेफ्ट गैस्ट्रिक आर्टरी एंड द राइट गैस्ट्रिक आर्टरी, बोथ दिस आर्टरी anastomose at the lesser curvature of the stomach. So this is the lesser curvature of the stomach where the left gastric artery anastomosing with the right gastric artery. Then the gastroduodenal artery further divided into the 2 parts, that is our right gastroepiploic artery, and the descending branch is the superior pancreaticoduodenal artery. Superior pancreaticoduodenal artery. So this is our superior pancreaticoduodenal artery, and this is our right gastroepiploic artery. From the splenic artery, there is a branch known as the short gastric branches. These short gastric branches supply the fundus of the stomach. And from the splenic artery, a branch come out. This branch is known as the left gastroepiploic artery. So the right gastroepiploic artery and the left gastroepiploic artery, both these artery anastomoses around the greater curvature of the stomach. Right gastroepiploic artery is a branch of the gastroduodenal artery, and the left gastroepiploic artery is the branch of the splenic artery. So it was the overall scheme about the stomach blood supply. Now we have to label the arteries. So first, which is a direct branch, this is our left gastric artery. ठीक है, तो जो लेफ्ट गैस्ट्रिक आर्टरी होती है वो डायरेक्ट ब्रांच होती है किसकी, सीलिएक ट्रंक की, और इसे प्रिंसिपल आर्टरी टू स्टमक, प्रिंसिपल आर्टरी टू स्टमक। तो जो आर्टरी स्टमक को प्रिंसिपली सप्लाई करती है दैट इज अवर लेफ्ट गैस्ट्रिक आर्टरी। देन सेकेंड ब्रांच इज द कॉमन हेपेटिक आर्टरी। दिस इज अवर कॉमन हेपेटिक। The common hepatic artery then divided into the upper, that is a proper hepatic artery, and the lower, this is a gastroduodenal artery. So this is a proper hepatic, and the artery which is descending down is the gastroduodenal artery. Is our gastroduodenal. Then the gastroduodenal further divide into the right gastroepiploic artery, right gastroepiploic, and the superior pancreaticoduodenal artery. This is our superior pancreaticoduodenal artery. सो होता क्या है कि जो गैस्ट्रोड्यूनल आर्टरी होती है ये आगे होकर डिवाइड हो जाती है राइट गैस्ट्रोएपिप्लोइक आर्टरी में एंड द सुपीरियर पैनक्रेटिकोड्यूनल आर्टरी. द proper hepatic artery gives a branch which is known as the right gastric artery, right gastric artery, and then the proper hepatic artery divide into the right branch and the left branch, and right branch gives artery to gallbladder, that is our cystic artery, cystic artery. So guys, I hope you have understood about all these things. Now we have to see about the left gastroepiploic artery, left gastroepiploic. So guys, what will happen to the left gastroepiploic artery? The left gastroepiploic artery is going to anastomose along the greater curvature of the stomach with the right gastroepiploic artery. So there are two kind of anastomosis, around the lesser curvature of the stomach and along the greater curvature of the stomach. Along the lesser curvature of the stomach, we see the anastomosis between left gastric artery and the right gastric artery. Along the greater curvature of the stomach, we see the anastomosis between the right gastroepiploic artery and the left gastroepiploic artery. So right gastroepiploic artery किसकी branch है? The left gastroepiploic artery is a branch of the splenic artery. It is our splenic artery. And then splenic artery giving to the branches. This is our proper, I mean splenic artery proper, splenic artery proper. So guys, this is our splenic artery proper, and from splenic artery the branch which ascend upward, these are short gastric branches, short gastric branches, and these short gastric branches supplies to the fundus of the stomach. So this part of the stomach is also known as the fundus of the stomach, which is being supplied by the short gastric branches of the splenic artery. What we have to see about the splenic artery proper? The splenic artery proper, this artery is the end artery. What are the end arteries? End arteries are the arteries which do not anastomose with another kind of arteries. So splenic artery proper is a kind of the end artery which do not anastomose with any other kind of arteries. This right gastroepiploic artery and the left gastroepiploic artery also supplied the curvature of the stomach by these short branches. So all these branches which are coming from the right gastroepiploic artery and the left gastroepiploic artery also supplies the greater curvature of the stomach. From left gastric artery there are some branches. These are the esophageal branches which supply the esophageal part of the stomach, or I means to say is that esophagus opens into the stomach at the cardiac orifice, and short left gastric artery gives esophageal branches which supplies the esophagus. So guys, this was all about the blood supply of the stomach. We have seen about the arterial supply of the stomach. In venous supply the same sequence is being followed, but only there is a difference that left gastric vein and right gastric vein then into the portal vein, and the right gastroepiploic vein is tributary to the superior mesenteric vein. So hope guys, I think you have understood what I want to say, and I thankful to you to listen to me, and I hope you also like this video. So please share, like and subscribe. Thank you so much guys.